Have you ever wondered what it's like to feel disconnected from your own self? Imagine a world where your thoughts, feelings, memories, or even your very identity seem alien, as if they belong to someone else. This is the reality for those living with dissociative disorders. Dissociative disorders are a group of mental health conditions characterized by an involuntary escape from reality. They may manifest as a feeling of being outside of oneself, observing one's actions as if they were happening to someone else. The sense of disconnection can extend to one's thoughts, feelings, memories, or even one's very sense of identity. These disorders can have a significant impact on a person's mental and emotional health, causing distress, impairing their ability to function in their daily life, and potentially leading to other mental health issues. Understanding these disorders is the first step towards helping those affected by them. So, let's delve into the world of dissociative disorders to better understand them. Imagine having two or more distinct identities or personality states, each with its own way of perceiving and interacting with the world. This is dissociative identity disorder. This condition, often referred to as multiple personality disorder, is one of the most misunderstood mental health disorders. The hallmark sign of dissociative identity disorder is the presence of two or more separate identities or personality states. These identities can have their own names, ages, genders, and even accents. They may also hold different attitudes, interests, and ways of thinking. The individual may feel like they have suddenly become a different person, sometimes without any memory of the transition. These separate identities are often accompanied by recurrent gaps in memory. This is not simply forgetfulness, but a complete loss of recall about important personal information, events, and periods of time. The affected individual might not remember certain events, personal interactions, or periods of time. So how does one develop dissociative identity disorder? The exact causes are not completely understood, but severe trauma during early childhood, often including physical or sexual abuse, is strongly associated with its development. It's thought that the disorder is a complex mental process that a child uses to cope with intolerable situations. When it comes to treatment, there's no one-size-fits-all approach. Psychotherapy or talk therapy is often the primary method of treatment. It can help individuals to safely explore their memories and experiences and to develop coping strategies. In some cases, medication may also be used to manage co-occurring conditions such as depression or anxiety. Living with dissociative identity disorder can be challenging, but with the right treatment and support, individuals can lead fulfilling lives. It's important to remember that mental health disorders like dissociative identity disorder are not a choice or a weakness. They are serious, real, and treatable health conditions. And with understanding, compassion, and the right care, those affected can navigate their journey towards recovery. What if you felt like you're observing yourself from an outside perspective, or that the world around you isn't real? This is what people with depersonalization derealization disorder often experience. Depersonalization derealization disorder, or DPD, is a type of dissociative disorder that consists of persistent or recurrent episodes of depersonalization or derealization. Depersonalization is an anomaly of self-awareness. It involves a feeling of being detached or disconnected from oneself, observing oneself from an external perspective. Individuals may feel as though they are an outside observer of their own thoughts, feelings, sensations, body, or actions. Derealization, on the other hand, is an alteration in the perception or experience of the external world, making it seem unreal. People might perceive a sense of unfamiliarity or alienation in relation to their surroundings. They could describe it as if they are living in a dream or a movie, or as if a glass wall or veil separates them from the world. The causes of DPD are not entirely understood. However, it's believed that severe stress, trauma, or the use of recreational drugs may trigger these feelings of unreality. For some, it may be a way of coping with a traumatic event, a sort of psychological escape hatch. For others, it may be linked to imbalances in brain chemistry. The good news is that depersonalization derealization disorder is treatable. Cognitive behavioral therapy is often the treatment of choice. This form of therapy helps individuals to understand and change thought patterns that lead to troublesome feelings, behaviors, and bodily sensations. In some cases, medication may also be used, although it's more of a complementary treatment, typically used to manage any co-occurring conditions such as anxiety or depression. Depersonalization derealization disorder can be a disorienting and distressing experience. But with proper treatment, individuals can regain a sense of reality and control over their lives. Understanding and acknowledging this condition is the first step towards healing. Remember, it's okay to reach out for help. Everyone deserves to live a life that feels real and fulfilling. Feeling disconnected from your own self or reality can be a scary and lonely experience. But remember, you're not alone. There's a profound significance in seeking help when one suspects they may be dealing with symptoms of dissociative disorders. This is not a journey you need to walk alone, and in fact, it's crucial that you don't. You see, dissociative disorders like dissociative identity disorder or depersonalization, derealization disorder are complex mental health conditions that require professional understanding and intervention. They often stem from severe psychological stress or trauma, and navigating them on your own can be incredibly challenging. Imagine trying to traverse a labyrinth without a map. That's what it's like trying to understand and manage a dissociative disorder without professional guidance. You could end up feeling lost, scared, and even more confused. That's where mental health professionals come in. Psychiatrists, psychologists, therapists. These are the people who have trained for years to understand the intricate workings of our minds. They have the knowledge, the tools, and the empathy to guide you through this labyrinth of self-discovery. When you reach out for help, you're not just getting a diagnosis. You're getting a plan, a treatment plan that's tailored to you, to your experiences, and to your needs. This plan could involve a blend of different therapies, medications, and coping strategies, all designed to help you manage your symptoms and lead a fulfilling life. And remember, seeking help isn't a sign of weakness. It's a sign of strength. It's an act of courage to acknowledge that something isn't right and to take steps towards understanding and managing it. Seeking help is about taking control, not losing it. In a world where mental health is still stigmatized, reaching out can feel daunting. But know this, every step you take towards seeking help is a step away from isolation and a step towards understanding, acceptance, and recovery. Reaching out for help is the first step towards understanding and managing these disorders. You don't have to face it alone. We've covered a lot of ground today in our exploration of dissociative disorders. It's been a journey of understanding these complex conditions that affect the mind, altering a person's sense of self and reality. We began our exploration with a general overview of dissociative disorders, shedding light on how these disorders disrupt the continuity of our thoughts, memories, surroundings, actions, and even our very identity. We discussed how these disorders often stem from traumatic experiences or severe stress, leading to a disconnect between a person's thoughts, memories, feelings, actions, or sense of who they are. We then delved into the intricacies of dissociative identity disorder, formerly known as multiple personality disorder. We learned that this disorder is characterized by the presence of two or more distinct personality states, or an experience of possession. Each of these identities has its own way of perceiving, relating to, and thinking about the environment and self. We noted that people with this disorder often suffer from severe memory gaps regarding personal information, not due to ordinary forgetfulness, but as a part of the disorder. We also explored depersonalization derealization disorder, a condition where individuals persistently or recurrently have experiences of feeling detached or disconnected from themselves. They may feel as if they are an outside observer of their own thoughts, sensations, bodies, or actions. They might perceive their world as unreal, dreamlike, foggy, or visually distorted. Despite the disconcerting nature of these experiences, we underscored that individuals with this disorder maintain an intact reality testing, meaning they are aware that their detachment is only a feeling and not a fact. In terms of treatment, we highlighted that therapies, such as cognitive behavioral therapy, dialectical behavior therapy, eye movement desensitization and reprocessing, and others, can be beneficial. We also mentioned that certain medications can be used to manage any co-occurring conditions like depression or anxiety. And finally, we underscored the crucial role of seeking help. It's important to remember that these disorders are not a sign of weakness or a character flaw. They are serious mental health conditions that require professional help. Seeking assistance is an act of strength and self-care. It's about taking control of your life and your mental health, and there's no shame in that. So, as we conclude, let's remind ourselves of the importance of understanding, empathy, and compassion in dealing with these disorders, both for those who suffer from them and for those around them. Mental health is a critical part of our overall well-being, and it's okay to ask for help when we need it. Remember, mental health is just as important as physical health. Don't hesitate to seek help if you or a loved one is struggling. Subscribe and don't forget to take care of yourselves. Goodbye.